Thank you, Dr. Neha. Thank you, Hindi team. Thank you, Sahani sir, and thank you, Dr. Shamim. Now we are moving to our English session. Today is our 1883rd day of continuous webinar. Let's start the webinar with a silent prayer. Good evening and welcome everyone. Today is our 1883rd day of continuous webinar. Today's our guest is Professor Paul Joseph from Canada. He's BHMS and practicing homeopath in Canada. And he has PG diploma in acupuncture, practicing in Toronto. And he was a former professor of Homeopathic Medical College under MGR Medical University and author and writer of various articles and published 2 books in Tamil about health and poem, and conducting radio program like hosting and doing radio talks in Geetavani and doing talk show in Canada also for 10 years, last 10 years. And I'm with pleasure, I'm inviting Dr. Paul Joseph to our session. You are welcome, sir. You can start now. You are not the host. Wait, sir.
Yes, he's already
already made. Okay. Okay, sir. You are welcome. Sir, unmute and talk, please.
Not I'm not the co-host.
That's why I told. Okay.
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 Okay. Sir, you can unmute yourself now. Now you are the co-host.
Okay. So
Thank
it's audible?
Yes.
Visible?
Yeah.
Okay. So greeting to you all at this time, because here is the morning time. It's about 11 o'clock. Maybe in India and different part of the world, different time. First of all, I thank all the organizers to invite me at least once in a month to deliver my experience from abroad. Especially congratulations to all the organizers of IFPH. Such an effort they made to promote homeopathy worldwide. So today's topic is GLORIA glandular acid phosphorica. There is no such a medicine. Yes, don't confuse, right? So that's I made this title in different way. I'll tell you what is that. So this is my building, which I have my own clinic over here in the 3rd floor. Yeah, just for your. So everyone you can invite. If anyone wants to visit Canada, I will send a letter, invitation letter. You can come and visit Canada, right? And meet your friends and relatives, no problem. So that is my invitation. So here in Canada, this is the fall season. You can see the beautiful. This picture I took. It's about yesterday. Just behind my clinic, you can see my clinic building. Just behind my clinic, there's a small river, right?
Yeah, 3 colors, right? Some are green and some are.
These are all not flower. These are the leaves.
Yeah, leaves. I understand.
Maybe another 1 week it can be like this.
Yeah.
After 1 week, yeah. Thank you. The Gloria means the praise and honor, right? Glandular means everyone knows that, acting on glands. So acid phosphoricum. So I'm going to praise here the acid phosphoricum, which is the remedy which acts on 3 type of glands in the related cases, which I am going to deliver here. So in my cases, all three cases, the first case is diabetic, this is a pancreas. Then second case, hypothyroidism. Third case, oligospermia. So this acid phosphoricum, they gratefully, wonderfully act on these three glands, right, in different dimension. That is very important. So in each and every case, you can understand how I approach the case, how I understand the patient as a holistic way. The first case is the case of diabetes, neurogenic sadness. I will explain later why it's happened. This is a 14 years girl, right, who diagnosed diabetes. So there are some, right, totality of symptom you can see here, right, fear, then illusions. There are some angers, ailments from, then brooding disappointments after. So I will explain later why this 14 years girl got disappointed. Then some epigastric symptom also here. Then there are other symptoms in stomach symptoms. Generals, you can see desire sweet. Then the indifference, apathy. I'll explain later why it's happened. So there are symptoms which are the mental symptom which I elicit, which I got it from the patient. So here, I'll put the audio of the mother. Is that audible?
No, sir.
Oh,
I think have you started to play?
no,
Share my personal story about my 14 years.
no, right?
Yeah. Now what?
Okay.
But even
I just want to share my personal story about my 14 years old daughter journey with a high sugar, and the journey that began unexpected and taught me how important to find the right medical care for my daughter. So in the first week of May, my daughter went to the regular blood checkup and her A1C came back 12.1. So she doesn't have any symptoms or anything, but as a mom with a high blood sugar, high A1C, I was deeply worried with the sugar number. So I immediately took her to the ER, and where the doctor suspected that is a type 1 diabetes because of her age. So they started on the short acting and the long acting of the insulin. However, I felt uncertain about the diagnosis and request additional tests to check the antibodies before continuing with both insulins. And so while we are waiting for the result, I gave the short and long acting, and then um the results came negative. So then I get the call from the doctor that they said that it is a type 2 diabetes. So the doctor prescribed the metformin starting from 500 milligram and gradually increase it to 2000 milligram. Even at that high dose, her blood sugar never came back within the range. I was very disappointed that none of the doctors explained why her blood sugar was so high. They simply prescribed more medication without identifying the cause. One day I decided to call Dr. Paul, and that call completely changed everything. He asked me to bring my daughter to his clinic, and he spent nearly 3 hours with her. He patiently explained 11 different reasons why the blood sugar can rise, helping us truly understand what was happening. And his careful assessment, Dr. Paul discovered the main cause of my daughter high blood sugar with her food choice and and also her mainly the stress level. He explained how lifestyle and emotional can have a major impact on the blood sugar and guided us through the changes we need to make. Dr. Paul began his treatment combined with acupuncture and his medication, and he instructed us to slowly reduce the metformin 500 each week. By end of August, he had completely stopped taking the metformin, and now my daughter has been continuing with Dr. Paul medication and the acupuncture with the healthy diet, regular exercise. So her blood sugar now is between 4 to 7. I'm truly grateful for Dr. Paul for his dedication, compassion, and holistic approach. He didn't just treat her number, he treated her as a whole person. From bottom of my heart, I want to say thank you for Dr. Paul for helping my daughter to regain her health and confidence. Words can never fully express my gratitude. Thank you.
So here, very interesting. Again, I'll share the slides. So here, this case, the first case, a 14 years old girl with diabetes, whose history was revealed by her mother. Just you listen, right? The short story of the girl. She was mentally affected, especially due to many problems at the conflict between her mother's sisters. So in this age, right, this conflict with their in the family, it affects her a lot. Due to this dispute that arose between them, the family of the girl affected by this disease was isolated from their family relationship. The girl family, it's isolated from their siblings, and sibling means the mother's and father's siblings. Not only that, her relationship with her cousins and other relative was suddenly broken. So here, the broken relationship. And the relationship with them came into an end. This happened, it's about a year ago. This girl who had been happily together for a long time with their cousins and relatives could not bear it due to sudden separation in the family. The girl began to suffer a great deal, the ordeal, right? Physical and psychological changes. So finally, I repertorized the case in different way. You can see the repertorization, right? The acid force came. So everyone knows acid force is one of the best remedy to heal, to cure the diabetic, right? But in this case, the picture is entirely different. So this was previously, right? In the month of May, the report was, you can see A1C 12, too high, right? Normal should be less than 6. So recently, it came to normal, right? Just you listen from her mother's word, right? So that is a very interesting story. The case number 2, hypothyroidism. So this case scenario is entirely different picture from this is also the same acid force case, but the picture entirely different scenario from the first case. You can see the repertorization right here. Again, the second gland, the thyroid gland. So these are all the totality. I repertorize again. You can see the mind symptoms. A lot of mind symptoms are there. And the acid force is the remedy. So how I interpret the case? So this patient's story, the scenario, how did the problem start in the second patient? That's very important. So they migrated from their home country, Sri Lanka, to Canada. So this the abundance of all their families' ties, the relationship and settled in Canada. It's about few years ago. So sudden changes in the location, sudden changes in the environment, the relationship. Even while in Sri Lanka, they faced various hardship, various problems due to the civil war. You know, it's about 2000, right? 9, before 2009. So they migrated from their hometown to other places, even in Sri Lanka itself, in the home country itself, several times, separated from their parents and relatives, and it's wandered around many places, one place to another. Then here the war started, then they moved to another place. So there are a lot of hardship they faced during their younger lifehood. After that, this woman got married and moved to Canada with her husband. On the other hand, a longing for separation for her relatives, parents, brothers. So this lady, too much attached with the family oriented, too much attached with the siblings and relative and cousins, the sisters, right? And they are hunting her for a long time. Then another important shock, it's happened in her life, right? You can see here what shocked her most was that when she found that her twins daughters, there are two twin daughters, were autistic. So see, only 2 kids they have, they are autistic. So she couldn't bear the shock. So it was after that, all kind of health problems started to appear. Various problems she treated, for various ailments she treated in different, in Western system of medicine. So finally, that end with the hypothyroidism. So now you can see the case, the story and background of the woman, right? So she was taking the Western medicine for thyroidism for many years. So after that they came. I'm also treating the autistic children too, right? They are little improving, maybe age about 15, 16 years, the twins, right? So slowly they are improving and they are reading and their concentration and their behavior slowly changed now. They are happy. But for this, the mother, this is a case of mother, right? So recently, every year they visit to Sri Lanka, and it's about recently, you can see this, right? The lady, the same patient, 39 years old, right? Last month, you can see the date here. Last month they visit Sri Lanka and they checked their thyroid level. Everything is normal. Even before that, they checked over here. So she I think is about more than 6-7 months. She stopped all the medications for hypothyroidism, and the patient is normal. Perfectly, she's okay. So this is the second case, acid pass which act on thyroid gland. The first case, the pancreas. This is the third case, case 3. Here you can see the case of oligospermia. You know what is oligospermia, right? The patient, they got married after 5-6 years. There's no issues. There's no kids, right? So that's why So finally, the Western doctors, specialist urologist, they diagnosed as a oligospermia. Exactly the number, maybe it's less than 5 million, I think. See, the history of recurrent inflammation in the scrotum due to various reasons, right? Swelling. But at present, when I saw the patient, that time there's no swelling, but there are a lot of the past history of recurrent swelling and inflammation happen, and they then and then they took antibiotic. So swelling and tension in the spermatic cord. Again, I refer the repertory of herring guiding. Right, you can see acid falls again. So the melancholy, because of it's not that much of the mental symptom. I couldn't able to get it, right? But while discussing, I can feel there are a lot of the mental symptoms also is there. Then the history of masturbation. So everyone knows all lycopodium and acid falls again. And this is the very important, right? Spermatoria, seminal emission, every other day, thrice in a week, even after sexual intercourse, next day and the following days, there are continuous, right, spermatoria, even with dreams or without dreams. So that's the main the theme of this case. So finally, I prescribe acid phos. So after 6 months, they got pregnant, right? One day, because it's about few days ago, they came for a second baby. This patient came to me 2022. It's about 3 years ago. So now they want another second one. So it's about few days ago they came for the next treatment. So I asked them to one day they can come and witness the acid phos. That's very interesting. They are ready. They are ready to come. They are young couple. That's why. At the same time, for this case, I prescribe X-ray, intercurrent remedy X-ray for few doses of X-ray, 200, and the mother tincture Salix nigra continuously for 3 months. Mother tincture. I don't know whether because I believe all the things it's together, it work and change the constitution, change the picture of the patient, right? So I believe these are the 3 remedies I gave. There's no acupuncture for this case. Even that the second case, there's no acupuncture. The first case I did acupuncture to improve general health. So see how the homeopathic remedies work wonderfully in such a glands. Usually the acid phos is not in the list of glandular remedy. Maybe in some cases but even though that it's working. So here we are going to see little discussion of acid phosphoricum. So generally this phosphoric acid they use widely in the fertilizer industry, right? You know what is fertilizer. But this case, I can't say like that, right? Doctrine of signature, infertility and fertility. No, that's not exactly, but generally they use for fertilizer. One of the ingredient of the fertilizer. Second one, the phosphoric acid they may use in different beauty product, right? As a skincare product. And dentistry also they used, right, to clean and fill this one. And I don't have any idea of that, but some literature they mention about that. And mainly the food industry. Most of the beverages like Coca-Cola and all kind of carbonated drinks, right? If the person, those who are fond of, those who are craving for this kind of beverages, the carbonated soda, like, right, this kind of cold drinks, 100%, especially in young people, right, youth, they are more interested in, they are favor of this kind of drinks, right? So think of acid phos, because that drinks, most of the beverages, it's contain phosphoric acid. Then the causation. It's a very nice picture. I got it from some of doctor's slides, right? Very interesting slide. The ailments from grief, ailments from bad news, ailments from sorrow, chagrin, then homesickness. These two, the second case, the thyroid case, the homesickness is, right? Because they migrated from one place to another, you know the story, right? Then disappointed love, injury, and shock. So these are all the causation and ailments. And here, the sexual excess generally, but those two cases, but third cases maybe the oligospermia cases, maybe it's suitable. So here you can see the doctrine of signature, right? Phosphoric acid is added, Coke, many other soft drinks in diluted form. Surprisingly, the patient who need homeopathic remedy made from all phosphoric acid. See, very, very, so whoever comes, just ask the history, at least whatever the totality come, give few dose of the acid phos, it will work. Then many of you know typhoid, right? Phosphoric acid is one of the typhoid, the remedy, as well as ailments from typhoid, ailments from different the infections, not only typhoid, the general bacterial and viral infection, the great prostration, the great the right debility, right, chronic diseases after the acute illness. So that's a thing of this one. Now we are going to discuss a little bit of the ideology of mental etiology and the psychological manifestation of acid phos. So most of the homeopathic remedies made from, what do you call, I'll stop the slide and you can see here the rubrics. I got it from different repertories. You can see indifference, one of the important things, right? And mind symptom. Indifferent, there are a lot of remedies like say sepia and other remedies also is there. But here, indifference and apathy. I'm going to explain what is the difference between these other remedies and all. See again the mind repertories, which are acid phos, source, the grief and loss, disappointed love. So I'll come later with this picture. Okay. So especially in homeopathic remedies made from acids group, they include some of the remedies, well-known remedies, acid picricum, oxalic acid, right? The acid floricum, sulfuric acid, benzoic acid. These are the remedies which are. So what is the main theme of as per doctrine of signature? When you put the acid, when you touch the acid, it's burned out. So burned out everywhere, right? So homeopathic acid remedies are often indicate for those who are suffer from some kind of burned out in various cases. That may be a physical burnout or maybe a emotional or psychological burnout. Very interesting things, right? You can see the doctrine of signature. So underlying theme of phosphoric acid is the best characterized as a struggle with adversity that lead to emotional burnout. All these two cases you can see, you can understand that the particular emotional burnout. Very interesting things. This burnout manifests primarily an exhaustion and in different persons who needs phosphoric acids has had endured the particularly difficult ordeal, right? Very, very interesting. The characteristic of this, the mental picture is ordeal. Ordeal means they are painful, horrific experience. In both cases, they had this kind of experience. The phosphoric acid, the silent, the very grief silent, after loss of loved one, after death of loved one, husband or children or siblings, right? So after that, they got very embarrassment, right? Humiliation, sometimes even ailments from humiliations. Another important mental picture is homesickness. So whoever had, right? Everyone we come across in, right, in different level in that particular situation, homesickness. Even we move to one place to another, right? Move to one situation to another situations. Changes. So whoever had ailments from changes, that changes in maybe from location to location, or changes maybe from one character to another, or changes maybe from job to another job, or changes maybe in life situation, like from menarche, then school life, then college, university, marriage, menopause, so and pregnancy. These are all the changes usually, regularly it's happened. So if the patient tells, the patient explains, right, the ailments after these particular changes, changes in the environment, changes in the life, changes within themselves, right? These three criteria, these three ideology, you have to, right, always you have to remember. So here, this diabetic case, the second case, the homesickness, right? Then ailments, usually the homesickness, not only that, the ailments after the changes in location and job or anything, whatever it's happened, right? Then the ailments after, I said, the physiological changes in their body, very important. I already explained. Then the ailments after that excessive reading. Usually, the acid force people are acid force patients. Usually, they are very very interested in novels. Continuously, they read novels and comics and comedies, storybooks, and also nowadays very important. I come across a lot of cases. Those who are watching all the serials, you know, the TV serial. So whenever the TV serial favorite guys comes, favorite people comes, give little few dose of the acid force, right? That's very interesting. And mental and physiological weakness. Why this happened? Because of the physical prostration, physical debility, right, and mental prostration, right, weakness due to loss of here in the physical weakness due to loss of fluid. That may be a seminal, or maybe a leukorrhea, or maybe a excessive menstruation, maybe a blood loss, maybe a sweat, right? Whatever, any body fluid If it is excessively, if it is lost, so you can think of the ailments after this effect, then you can think of acid pause. So in such a way, again, it's mental lost again, right? Different, right? The root cause. But these patients, the acid pause, the healthy patient, now we are discussing about the real case, right? So what happened before they landed into the acid pause situation? Before, entirely the picture was completely, it's different, right? They are very interested. Here, in a real acid pause case, indifference, apathy, no interest, nothing, right? But before that, they are interesting. They had all kind of, right, gardening job, reading, and all the hobbies, cooking, right, painting, reading, everything. So after that, when the situation comes, when the ailments come across, they lost all the interest, all worldwide interest, worldwide activities, right? What they lost everything. That's a very the important things. People who are very strong confidence, emotion, once upon a time, they are very confident in their right emotional level, mental level, physical level. Now, just opposite. The picture is upside down. After grief, after humiliation, after this kind of, after loss of the fluid, whatever it's, right? Then mental ability first, then followed by physical weakness. In one Materia Medica, I think that the George Vidalcos Materia Medica, he mentioned this word, the frozen emotion. The person lies like a lock. In Tamil, we call marakata. You know marakata? Like the patient feels like a wood piece. Right? The person who need the acid force, right, begins to collapse and he or she become emotionally worn out, emotionally the burnout I explained before. No energy left, completely like that, right? Completely it's gone. And other important things, the phosphoric acid was primarily a remedy of emotional fatigue. Fatigue begin on the emotional level and can sometimes extend to, as I said, in physical right way. But these two, the diabetic case and the hypothyroidism case, you can see the marvelous right picture over there. And physical and mental level, may complain of feeling numbness, completely numb. It's like a right the emotional numbness. Some literature they mention about emotional numbness. The acute, the frustration, acute emotional shock, it leads to the chronic illness, right? The fast act, the remedy for grief, it looks more like a state of collapse than acute grief. Usually in acute grief, we give ignatia. The chronic one, the grief, the worry is become, when it turn into sorrow, then sorrow is turned into grief. First the worry. Worry is the normal. If anything happened, we used to get worries. That is a routine emotion. The worry, right, in the intermediately it change into sorrow. Then finally it end up with grief. The completely is gone, right? Grief. So that status, right? If it has happened acutely, then you can think of ignatia. If it is chronic, end up with the chronic illness, then the acid pause came. The feeling despair and hopelessness, it more comfortable to the indifference, right? Sepia indifference. Sepia indifference and the acid pause indifference is different. So what happened in sepia? Sepia indifference has hormonal etiology. Phosphoric is mainly indifference. It's come from all drainage, mental and physical drainage, right? Burnout, and absence of feeling, the absence of emotions in acid pause. But sepia, the emotional level still maintained. So there are very interesting comparative study you can, right? And also the same picture, Staphylococcus aureus, right? That's also very interesting, right? Well, already, I think it's about few months ago we were discussed about Staphylococcus aureus in such a way. The root cause of indifference here, right? Usually it starts from childhood, right? The picture, this entire scenario, in most of the cases, it starts from right in childhood. Childhood abuse. Victims of, very interesting, what I am going to tell now, it's very interesting thing. Victims of single parents. Single parent mean after divorce, right? Or parents they lost. The boy and girl who, right, they put it in the hostels, in the boarding school, those who are grown up in the boarding school. Victims of lack of love, even at home and outside. The victims of forsaken feeling. No protection, no emotional insecurity, right? It started from younghood, in childhood, in young adult, in teenage, right? And very interesting things, if any cases come across mental trauma, right? Maybe in different, right, areas, mental trauma. Most of the cases which I had from Sri Lanka, right, Sri Lankan, especially in Tamils, right, they had this history, right, the mental trauma, post-traumatic stress disorders, right? That's one of the root cause of this acid pause. The phosphoric acid gives us a sense of just how important the keynote, very, very, very important keynote, right? Future is we found in the list of under the mind indifference. So you can see a lot of rubrics are there. Indifference on, especially that this kind of the moody situation, brooding, moody, apathy, not interesting things, right? Especially in the morning when they wake up. Again, they put the bed sheet and they lie down. Then again, wake up. There is no interest to wake up in the morning, right? Loss of disappointment, repeatedly I am telling. Disappointed love are common triggers, right? Especially in teenagers, I already explained, right? In case of breakup, you know, the love breakup, that is very important, especially from girlfriend and boyfriend, you know, all these stories, right? So if it is this, the scenario, then you can think of this kind of experience. If patient had in the past or maybe at present, then you can think of acid pause, all right? Then the another things, ailments after acute illness, right? That leads to prolonged battle or prolonged conditions, chronic illness, right? Because of suppression of all infection with antibiotic, suppression of all the acute illness, acute infectious diseases, right? By various means, maybe steroids or maybe antibiotic or whatever, that may lead to, if chronic illness, if 100% sure, you can think of acid phos. And also nowadays, most of them, they murmur in this diagnosis. Most of the cases, what is that? Chronic fatigue syndrome. We heard about it. I think many of you heard about chronic fatigue syndrome, right? Like maybe chronic fatigue syndrome or fibromyalgia, whatever it is, right? Very interesting remedy, the acid phos. And the etiology, including bad news, ailments from bad news, embarrassments, right? Hard friendship, broken friendship, drug abuse, alcoholism. Because of all these stories, after failure, love failure, and they end up with, most of the cinemas, right? They end up with this kind of things, and then think of acid phos. Then people of anybody, in terms of the cold drinks, those who are desire for cold drinks and carbonated drinks, addict to Coke, addict to, right, this gas, the gas form of, right, carbonated form of drinks. Bubbles, you know what is nowadays is in Canada, it's most of the people, they drink the bubble, right? So those kind of things, you can think of the acid phos. And the loss of fluid, already I explained in various means: dehydration, lactation, bleeding, right? Night sweat, menses, postpartum, right? So these kind of changes, as well as the changes in physical, and also the changes in their life situations, right? In various means. And very important remedy, the loss of hair. I think many of you had experience with the loss of hair. Gray hair, premature gray hair, very important. Young adult, young teenagers, they have premature gray hair. Alopecia, loss of hair, right? After acute and chronic illness, after surgery, after prolonged admission in the hospital, prolonged bedridden, followed by then the hair falling. If it is there, then you can think of acid phos. And acupuncture, there are some other remedies like you can see here in the these are all I explained, most of the things. There are some other remedies, the relationship, remedial relationship, complementary and compare remedies, Sepia, Silesia, China, right, number one. Then Calcarea phos, and because the acid phos acting on long bones, especially the people like a phosphorus, you can think of acid, the constitution, and phosphorus constitution, right? Tall and slender, phosphorus. The same way in acid phos also, tall and slender boys and girls, and right, the same picture, like. Then Heliborus, sorry, I forgot to tell that the bone pain, gnawing, right, very growing bone pain, especially in children, especially long bone pain at the end of the bone, near to the joint, right, long bone, the both end, if the kids or children, they feel pain, then you can think of calcarea pause and acid pause like that. Then there are some other remedies too. I think that's question time. So most of the thing I explained, most of the picture of acid pause.
Thank you,
Thank
Dr.
you.
Paul. Thank you so much. Thank you for your clear and detailed explanation. It gives us a clear picture of acid force through your case presentation. Thank you so much. And the participants, if you want to ask any questions to Dr. Paul, you can raise your hand and ask. We have 7 minutes more for your queries. Dr. Danesh, are you?
Yes, Dr. Paul Joseph. As usual, as usual, you really rocked with the acid phosphoric. And why these you have shown the different colors from your called,
All season.
yes, yes,
Yeah.
seasonal changes in your place itself. And what's your opinion on using this regularly? Because people used to give acid force regularly to these diabetic patients in managing with a 3x or 3 6x like that. Have you ever experienced such method? Or,
No, I don't have any experience
uh,
with that.
and that, okay,
When the
okay,
totality
you
comes,
you really goes with the totality rather than simply giving the medicine. Okay.
but for this diabetic case, I even I didn't give any mother tincture. They were usually what we write the Sebelentra, whatever. There are a lot of mother tincture. I didn't give any mother tincture. Only one, not single dose, the frequent dose, right? Daily dose. First I started with 200, then now it's 1 m. Not daily, every other day, but slowly. Maybe next week I am going to withdraw all the medicines. In between, I
For
did some.
the first case, how much time was
Not
required?
just the patient, they came in the month of uh, August, the beginning of August, then completely August, September, then yeah, already now it's October, right? So I stopped all the medication, all their medication. They prescribe up to 2000 milligram metformin. So it's about within a month I stopped all the things in the month of middle of September.
The real reason behind giving that medicine was the quarrel between dispute between the
Yeah. That is
mother and the sister. So
from that it.
in all cases where there is a dispute going on between the brother and the father, is it applicable to the same? It's
No,
just
no, 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 no. How they perceive, but this girl, how they perceive, right? This is the family situation happen everywhere, right? You know, in your family and my family, everywhere this happened. But how they perceive these kids, if it is happening even in the adult, but they don't worry about. Sometimes they later they become in some marriage or some function, family function comes, they unite together. But here, this girl, because of age, right? That age, she took very seriously. So that's why it's happened.
Okay,
okay.
Dr. Danesh, thank you. I think Dr. Sevki, she wanted to tell something. You are welcome, please.
Thank you. Good evening. And I'm very happy to hear again. And Dr. Manoj, Danesh, and all of IFPH, thank you so much. And Arjun. And Dr. Paul, a very wonderful session. I'm happy to learn a lot of many things about phosphoric acid, and I'm using in phosphoricum acidum some cancer patients for bone metastasis and really severe pain and wonderful result I take. And the others one post-COVID syndrome and some after COVID 1 or 2 years later, he or they feel very exhausted, and phosphoricum acidum is really good effects. And thank you very much. And diabetes is a wonderful result, and all of your knowledge is very important for us. Thank you so much.
Are you from which country? South America?
No, not. I'm Turkey.
Turkey. Oh, that's good.
Yeah.
No, you are back in Turkey, or you are still?
Yeah, I'm here in Turkey, in West Turkey, in Izmir. I'm my hometown now.
In between, you visited Canada for some purpose.
Yeah, I really, I won't, maybe later, because the fifth year's ceremony I will want, maybe later, 6 or in others time, because I'm in England that time, and I didn't went to England, yeah, India.
Okay, thank you, thank you.
Thank you.
Okay. Thank you, Sevi.
Thank you. Thank you.
Thank you so much. And now it is the time for the Malayalam session. Thank you, Dr. Paul Joseph, for such a wonderful session on behalf of IFPH. Really, you taught everything about acid force. Thank you so much. And now I am handing over the session to, good night, everyone. See you the same time tomorrow. Love you all. And I'm handing over the session to Dr. Manoj for the next Malayalam session.